At 6, people across our region could soon see their health insurance costs skyrocket. That's because key Affordable Care Act tax credits are set to expire after Congress passed a bill to reopen the government without an extension. Nearly 22 million Americans could be affected. WSN9's Sarah Robertson talked with one Maryland woman who says that losing those credits would upend her finances.
The fight over these ACA tax credits was a key sticking point between Democrats and Republicans, and one of the issues that dragged the government shutdown on. The government is now reopened, but Congress passed a bill that did not include extending the tax credits. Now families who rely on them tell me they're scrambling.
I know that we're not going to be able to afford going forward without the subsidies.
This Maryland small business owner, who wanted to remain anonymous, says losing her ACA tax credits would be devastating.
Next year's premiums are going to be almost equivalent to what our house payment is going to be.
The current enhanced subsidies, first introduced in 2021 under the American Rescue Plan, lower monthly premiums for millions of low and middle income families. They're set to expire unless Congress acts.
Because I have a pre-existing condition, it makes it very difficult for me to buy health care through a broker.
She says it's so unaffordable without the credits. She and her husband have even talked about walking away from the small business they've built over 15 years just to get employer-based insurance.
My prescription I have to take for the rest of my life, and it is rather expensive.
A new analysis from the Kaiser Family Foundation shows that without these credits, average premiums for low and middle income families could more than double, jumping from about $888 a year in 2025 to roughly $1,904 in 2026.
I disagree based on the analysis that I've done.
Mike Arrigo, a medical billing expert witness, says he believes some families will see increases, but maybe not as steep as those estimates.
And I sympathize with any increase in cost for any family, absolutely.
He says regardless, families should shop around.
The devil's in the detail. It always is in healthcare. You have to look carefully at it. Compare health plans, compare the premiums.
The tax credits are set to expire December 31st, and right now lawmakers are discussing subsidy options, but no concrete plan is on the table yet. Reporting in the newsroom, I'm Sarah Robinson, WUSA 9.